Hello and welcome to Medical Dialogues, your dose of health and medical news. I'm Roshni Dhar and today I'm going to talk about the effect of fluid bolus administration on cardiovascular collapse among critically ill patients undergoing tracheal intubation. Among critically ill adults undergoing tracheal intubation, administration of an intravenous fluid bolus compared with no fluid bolus did not significantly decrease the incidence of cardiovascular collapse, according to recent research published in JAMA. Hypotension during tracheal intubation results in part from medication-induced vasodilation and decreased return of venous blood to the heart due to increased intrathoracic pressure from positive pressure ventilation. The intravenous administration of a crystallized solution might counteract these effects by transiently increasing intravascular volume. Current international guidelines and expert recommendations suggest that critically ill adults undergoing tracheal intubation receive a fluid bolus. A fluid bolus is administered during approximately 40 to 50% of emergency tracheal intubations in current clinical practice. The randomized clinical trial enrolled 1,061 critically ill adults undergoing tracheal intubation with sedation and positive pressure ventilation at 11 intensive care units in the US between 1st February 2019 to May 24, 2021. The date of final follow-up was 21st June 2021. Patients were randomly assigned to receive either a 500 ml intravenous fluid bolus or no fluid bolus. Among 1,067 patients randomized, 1,065 completed the trial and were included in the primary analysis. The cardiovascular collapse occurred in 113 patients in fluid bolus group and in 96 patients in the no fluid bolus group. New or increased receipt of vasopressors occurred in 20.6% of patients in the fluid bolus group compared with 17.6% of patients in the no fluid bolus group, and a systolic blood pressure of less than 65 mm occurred in 3.9 versus 4.2 respectively. Cardiac arrest occurred in 1.7% versus 1.5% and death occurred in 0.7% versus 0.6%. Death prior to day 28 occurred in 218 patients in the fluid bolus group compared with 223 patients in the no fluid bolus group. Thus, the authors concluded that among critically ill adults undergoing tracheal intubation, administration of an intravenous fluid bolus compared with no fluid bolus did not significantly decrease the incidence of cardiovascular collapse. A 30-year study that links childhood obesity and fitness to midlife cognition. The world's first study of the impact of childhood fitness and obesity on cognition in middle age followed over 1,200 people who were children in 1985 for over 30 years, has found that better performance on physical tests is related to better cognition later in life and may protect against dementia in later years. Importantly, these findings are not impacted by academic ability and socioeconomic status at childhood or by smoking and alcohol consumption at midlife. Research led by Dr. Jamie Tate and Associate Professor Michael Galecia from the National Centre for Healthy Aging based at Peninsula Health and Monash University in Melbourne, along with investigators from the Childhood Determinants of Adult Health Study from the Menzies Institute for Medical Research at the University of Tasmania. The landmark study is published today in the Journal of Science and Medicine in Sport. Following over 1,200 people from 1985 when they were between 7 to 15-year-old all the way to 2017 to 19. This is the first significant study to look for links between objectively measured fitness and obesity in childhood with cognition in middle age, with the idea that early activity levels, fitness and metabolic health may protect against dementia in our older years. In 1985, 1,244 participants aged 7 to 15 years from the Australian Childhood Determinants of Adult Health Study were assessed for fitness and anthropometry. These participants were followed up between 2017 and 2019 in respect to their cognitive function using a series of computerized tests. According to Associate Professor Calcelia, this is the first study demonstrating a relationship between phenotypic profiles of objectively measured fitness and obesity measures at childhood with midlife cognition. The researchers found that children with the highest levels of cardiorespiratory and muscular fitness and lower average waist to hip ratio had higher midlife scores in tests of processing speed and attention as well as in global cognitive function. Because a decline in cognitive performance can begin as early as middle age, and lower midlife cognition has been associated with a greater likelihood of developing mild cognitive impairment and dementia in older age. Associate Professor Calslia states that it is important to identify factors in early life that may protect against cognitive decline during later life. The diversity of centrosomes, which delivers nucleus for neurological diseases. Magdalena Gotts and her team evaluated in neurons a notion of similarity of the centrosome in all cells and their developmental precursors, so-called neuronal stem cells. There is so much we don't know yet about these cells, including how the centrosomes of neurons compare to those of neural stem cells and other cell types. Their subsequent discoveries now fundamentally challenge the assumption that all centrosomes are created equal. Centrosomes are in fact not one-time-fits-all. In close collaboration with the Helmholtz-Munich Programmatic Core Facility led by Stefan Honk, the researchers found that the composition of proteins in centrosomes differs profoundly depending on the cell type. We were surprised not only by the unexpected high degree of heterogeneity of the centrosomes, but also by the discovery of many unexpected proteins associated with them, for example, the RNA binding proteins and even proteins responsible for splicing, which normally takes place in the nucleus, Gotts explains. The location of centrosome-associated proteins is crucial for disease. The scientists discovered that a specific protein is enriched at the centrosome in neural stem cells, but not in neurons. A mutation of the protein found in patients with brain malformation, periventricular heteropophia, also leads to a similar phenotype in animal models. Magdalena Gotts concludes that this means that the location of a protein is crucial for a disease. With our centrosome analysis, we now have an important resource to test further associations with neuronal diseases. In particular, our research can explain for the first time why a protein that is present in all cells after mutation causes a phenotype only in the brain but not in other organs. This will allow further insights into disease mechanisms and thus get one step closer to the treatment. Efficacy and safety of uterine transplantation. The study published in the journal Fertility and Sterility covers transplantation of uteri from living donors. After 7 of the study's 9 transplants, in vitro fertilization treatment ensued. In this group of 7 women, 6 became pregnant and gave birth, and 3 had 2 children each, making the total number of babies 9. In terms of what is known as the clinical pregnancy rate as well, the study shows good IVF results. The probability of pregnancy per individual embryo returned to a transplanted uterus was 33%, which is no different from the success rate of IVF treatments overall. The researchers noted that few cases were studied, and nonetheless, the material including extensive long-term follow-ups of participants' physical and mental health is of top world class in the area. None of the donors had pelvic symptoms, but in a few, the study describes mild, partially transient symptoms in the form of discomfort or minor swelling in the legs. After 4 years, health-related quality of life in the recipient group as a whole was higher than in the general population. Neither members of the recipient group nor the donors had levels of anxiety or depression that required treatment. The children's growth and development were also monitored. The study involves monitoring up to the age of 2 years and is accordingly the longest child follow-up study conducted to date in the context. Further monitoring of these children up to adulthood is planned. The first birth after uterine transplantation took place in Gothenburg in 2014. Another 7 births followed within the framework of the same research project before anyone outside Sweden gave birth following uterine transplantation. The research group has since passed out in its methods and techniques through direct knowledge transfer to several research centers outside Sweden. By year-end of 2021, the number of uterine transplants in the world was estimated at 90, of which 20 had been performed in Sweden. Worldwide, some 50 children have been born after uterine transplantation. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.